Welcome to the Navigating Dental Insurance Podcast, where we don't take from insurance companies. Here are your hosts, Mr. Jordan Comstock and Mr. Ben Duine. This podcast is sponsored by BoomCloud Dental Membership Software, www.boomcloudapps.com, and Veritas Dental Resources, www.veritasdentalresources.com. Enjoy the show.
Welcome to another exciting show to the Navigating Dental Insurance Podcast. This is our Say No to PPOs series. I am your co-host, Jordan Comstock, and I got on the line with me again, Ben Duine. How you doing, Ben?
There. Great, Jordan. Hey there, everybody. Welcome to the program. Another day, another exciting day, sunny, and great guest as always.
Yes, today we're having Dr. Christopher Phelps come back on our show because he is an awesome guy and wanted to come back on, and I said, yeah, let's do it. Let's bring him back on. I think he's a very good resource to our audience and to the dental industry. Oh my gosh, the dental industry in general. I can't speak for some reason.
No,
today, Ben.
you're fine. You know, we can't hit the point home hard enough about how important it is to activate the uninsured out there. People don't get it. People don't realize how much of an opportunity that's a bigger opportunity than the PPO market, and yet it's one of the most ignored.
Absolutely. Our last episode we had ProCare on Mark Costi's podcast, a replay of that, talking about the same idea of capturing a similar market there. It's just a huge opportunity for the dentists out there, and for some reason a lot of them just aren't doing it. Well, more and more are doing it, I should say, but there's still a huge opportunity out there.
Yeah, our goal is to revolutionize the way things are done in the industry. ProCare is going to take over insurance and hopefully replace a lot of the crappy insurance that's out there. But the membership programs is something that's never going to go away. There's just simply a lot of people that are not going to buy an insurance plan or not going to buy a ProCare program, which that's going to be open up for the uninsured to buy too. But more than half of the public doesn't have insurance. I mean,
yeah, it's crazy.
And this interview, we already did this interview with Dr. Phelps. The key point that I think you should pay attention to is really how to present this to patients. I mean, I tell my story about how an urgent care got me to buy their membership program, and then got me set up on an automated payment program every year. But it was a no-brainer. It was a no-brainer for me to enroll with a program like that because I had nothing to lose. I was saving money immediately. But now it became something that was on my mind. Anytime we had urgent care needs, guess where we went? We didn't go to the hospital. I mean, we went to urgent care. I mean, it's such a genius idea. And you know, Jordan is the expert in this area, and we look forward to having this interview on.
All right, welcome again. We've got another exciting guest on our podcast. He's been on it once before. We have today with us Dr. Christopher Phelps. Dr. Phelps, how are you doing today?
Good, Jordan. How you doing?
Doing good. Thanks for coming on to our show again. We're excited to have you on.
Yeah, it's nice to have you.
Yeah, and I was emailing you a couple weeks ago. It sounds like you were in Germany. Was that correct? You're in Germany a couple weeks ago.
The IDS meeting, which is the largest dental meeting in the world.
Really?
So you had 155,000 dentists all in Cologne, Germany.
Wow.
I guess they run that meeting like every 2 years, and so all the dental technology for the world is unveiled there, if you will. And you know, if you kind of imagine our largest trade show, like say a Chicago Midwinter meeting or maybe the Hinman in Atlanta. It was about 22 times the size of that.
Wow! Holy cow!
Yeah.
So did you speak over there, or did you just go attend it?
No, it's a total trade show. There's really no like CE or anything like that. Although you know, some of the companies they had certain people speaking. So I was over there just kind of making connections and looking for new technologies and kind of promoting the Phelps Institute. And ended up picking up a few sponsors for that.
Very cool.
Checking out the latest technologies. Sensors and 3D printers and all the things that are coming down the pike for dentistry, and it was pretty cool.
So, do they always have that in Germany, or do they rotate countries?
No, it's always in the same place in Germany because I think this is the only facility in the world large enough to hold over 100,000 people.
Yeah.
In one.
Wow, 100. Did you say 155,000?
Yeah,
wow.
that's crazy.
Holy cow! And Germany likes to hog it each year. I guess, like
Hey,
you said, they.
I wouldn't mind going to Germany. You know, they have the Autobahn there. You know, you can rent a Lamborghini and kind of go crazy.
And cruise around. That sounds
Exactly.
pretty fun, Ben.
And it's the home of a good Grolsch beer, which was kind of cool. So we did a little tour of the beer factory and got some free samples. So that was always fun.
Did you bring it? Did you bring enough back to share with your presentations with the?
Yeah, that's right. You know, I was, and then I drank it.
That's awesome. Well, cool. That was really interesting. I didn't know they did a big conference over there in Germany. So when you emailed me, or I saw you coming on our thread and say that you're in Germany, I thought that was kind of cool. So let's get started here. Today I want to have Dr. Phelps come on because there's a few questions that I have been getting, and then I spoke to you as well, Dr. Phelps, and you've said you've been getting a lot of some of these questions as well about membership programs. So we're going to talk a few things about membership programs, and then I do want to focus on talking about what you're an expert in as well, Dr. Phelps, is the principles of influence. So we'll be talking about that today on our show. But the first question I have for you is a membership program a good idea for an existing fee-for-service practice?
Yeah, I mean, I think it's not only is it a good idea, I think it's a must. The more I see with corporate dental groups expanding their presence in the dental field, like a tsunami, like a big wave that's just coming and getting bigger and bigger. In businesses like Supercuts, and the CEO who started Supercuts, the cheap haircut place, saying he's going to start a Supercuts model for dentistry. 3 prices for everything that we do, every service. Will be
Wow.
included. Yeah, you see, like dental insurance companies are actually owning dental practices up in the north. It's ridiculous. So in all of these areas, these larger groups are leveraging their size to get more reimbursements for their insurance premiums, for their insurance claims or whatever, which means, the insurance company is not in the business to lose money. So if they give more money to one group, they got to take it away from another group, which is us, the solo practitioner.
Yep.
So, today it maybe you got to do 10 crowns to get paid for 8. But eventually I think it's going to be, you're going to have to do, 10 crowns to get paid for 3. And when it gets like that, you just can't compete in that space long term. So I think making some changes today by going after a different market, someone who doesn't have dental insurance, and who would go to the dentist if they had the sense that they had insurance, which is what a membership savings plan can do for you, can totally change your practice, not only to hedge your bets and diversify now, but protect you for the future.
Yeah,
Awesome.
That's a great idea. You mentioned this bit about PPOs, insurance companies taking it from one group and giving the fat to another group, which happens on a daily basis. A follow-up question to what Jordan asked is, so I have actually had a call earlier this morning with a doctor prospect out of Minnesota. Participates only with Blue Cross and Delta Dental, but the rest of his practice is fee-for-service. Blue Cross and Delta Dental only represent 20% of his total revenue, and he does about $2 million a year.
Wow.
He came to me thinking that he needed to join more PPO plans in an effort to help boost his patient flow. And when I went through the numbers, 80% of his practice are a mixture of fee-for-service and PPO, but majority PPO. He sees a bunch of patients out of network. So, and going down the list of all the insurance companies, if he were to join one of those insurance plans out there, he would lose money and probably take him 2 to 4 years to recoup those initial losses, because you have to take a write-off. You have to take a discount when you join a PPO plan. How is this different? How is the membership program different in terms of not losing money, or do you lose money if you're a fee-for-service office and engage in an aggressive membership program?
Yeah, great question. Well, it kind of goes back to the psychology of it and the mindset of how people act when they have a savings plan or a membership plan. They did that study with comparing the shopping habits of consumers at Costco versus Walmart. At a Walmart, you can go in there, you don't have to be a member, you can buy whatever you want. Whereas at a Costco, you have to pay a membership fee for the year just for the rights to shop there. And in theory, you can buy the same TV at both places. So you would think on the surface that more people would spend more money at Walmart and more frequently because of that. But the study showed that the people at Costco who paid for the rights to shop there actually spend on average 247% more per trip than the shopper. And the idea is because of the membership plan, right? So when people have a membership plan, they feel like they've committed to this idea, which is a powerful influence principle, right? When you make real commitments.
Yeah.
They've committed to this idea that I'm going to save the most money here, so I'm going to pool my resources. I'm going to spend more of my money here than I would elsewhere. And so people that have a savings plan spend more. It's just a fact. You know, when I was tracking it in my office, you know, the average person spends an additional $1,254 a year on top of the $299 fee.
Wow.
Wow.
Hey,
Very cool.
Follow-up question to that. Jordan, you and I were at the UDA last week. And we won't mention the other plan, but there's another plan that's out here that's in the market where they don't even charge a fee for somebody to participate in their membership plan. Is there a difference between charging a fee, like you charge $299, and this other group doesn't charge anything? Do you see any differences, or do you?
I would definitely.
Go ahead. Sorry.
I was gonna say, yeah. I mean, I would definitely charge something.
Yeah,
I mean,
I agree.
Yeah, I think it's crazy as well.
Yeah. So the idea is, it's like most things, especially with the influence principles. It's not about the price. It's about what you say you're due before you talk about your price. Mm-hmm. And so one of the things we talk about is the contrast principle. People always compare what you tell them to something. So any number you throw at someone, they're going to compare that to something in their life. The problem is we don't control what they compare it to. Yeah. So if we can change that a little bit, and suddenly it sets the stage for more people to say yes to what we're saying. So if you just throw out there that it's $299, which is maybe what this group was doing, they may get some resistance because people may think, well, geez, $300 is more than what I'm paying for my utilities. It's more than I'm paying for my whatever.
Right.
And if they have that, they on this fixed budget, which is the retirement mindset. You know, they think they've only got a certain amount of money available, and it's taken away every month, so they got to hang on to it. Then I could see that being a challenge. But when you instead of just throwing out your $299 price, if you first talk about how that if they try to go get dental insurance on their own, it would cost them $600 a year for a policy, but they can get the same, if not better, benefits at your practice with your dental membership plan for only $299. Well, suddenly that starts to make more sense. Or I know some people I've been talking to recently, and I kind of like this idea. They're charging $365 for their plan. Yeah. But the idea, the kind of tagline I kind of came up for them is that the road to better dental health starts from only $1 a day.
Yeah.
Oh, nice.
I like that.
Now, from a contrast standpoint, people are like, "Oh, well, I can afford $1."
Oh, it's $1? Yeah.
Yeah.
No, that's a good point, doctor. And I've done a few things like that with my own business when we, compare it to another similar situation. I think that works really well. I mean, I've seen that work really well with just when I'm talking to people about our program and things like that. But very interesting. I love that concept there. So I got another question for you. This is a question I get pretty much every day talking to practices. And I want to know your thoughts on annual plans versus monthly plans for a membership program.
My feeling is that I charge by the year. So I charge an annual fee. And because to me, $299 is affordable, especially for my market. So they're active, independent living retiree. I know they can afford it, and so my thinking is if they can afford the $299, especially if we framed it in the right context, starting them out with the price of insurance first, then that's not really going to be the type of patient who can afford my other services.
Yeah.
So for me, I try to do annual plan.
Dr. Phelps, that's consistent with what I see out there. Is that the annual plan seems to be the more popular in terms of how it's presented to the patients. Circling back to this fee-for-service practices that are concerned about losing money if they do a membership program. I know you answered that in a great way. In my mind, what I'm thinking is that a lot of these fee-for-service patients, that the way you address it is that they're not using, well, number one, they don't have any benefits to use, so it's not on their mind, out of sight, out of mind. They're just not using or coming in and getting as many procedures as those that have insurance or on a membership program. But a fee-for-service practice that's concerned, if I do this and lose money, if I do this, will I lose money with a membership program? What's your response to that question?
Yeah, and my answer is it's a short-term loss potential, but long-term gain. And so what I mean by that, and I'm talking about how the average office does this, because the number one mistake I see them making is they start their own membership plan, and they've got the wrong market. They think it's just for their existing patients, and that's not the case. So if you're just planning on offering this to the existing patients that are fee-for-service that you have, then yeah, in the short term, you're going to lose revenue. I mean, these people paid you your full fees last year, so if this year you give them all a 10 or 15% discount off of their work, then you're going to have less money, less revenue potentially. The idea behind this is, the long-term gain here is, though, it may motivate more people to do treatment because you gave them the discount. So that might offset some of that loss. Plus, it's going to close your back door in the sense of few people are going to be leaving the practice than are leaving now. Why? Because now they're not going to be attracted by the next shiny new ad they see. It's not just the relationship with you, it's the relationship and your office has a savings plan. Right? And they're a member there. Whereas in other offices they may go to, they don't have a relationship with them, they don't know them, and they don't offer the savings plan as a result. So if we're closing our back door, well, that means that's going to save us in marketing and external marketing money, especially to get more new patients. We're not going to need as many new patients per year with that.
Yeah.
So if you're just going to use this on your existing patients, it's a short-term loss, but potentially a long-term gain. The other thing to think about is, remember that when it doesn't have to eat into your profits that much, because if you flash back to when I started my plan, I raised my fees 7% and then get the 10% discount, 15% discount off of that. Right?
That's awesome.
I mean, most I hadn't in like 3 years, but so I was due. But I mean, and you think about it, your fees are going to go up every year, are they not? Don't we increase those? So eventually, how much of a discount is it really costing you? Not really. You got to remember, people focus more on the discount itself versus what the actual expense is. Kind of like that one patient I had who came in at the front desk one day and said, hey, I hear you got this savings plan, and so if I buy it today, I could use it today. And I was like, yeah, of course. He said, well, I got 5 crowns, so I'd save 10% off all 5 crowns. I was like, yeah, of course. He said, okay, and he takes out his phone and he calls the dental office literally across the street and says, hey, this is Bill. I'm not going to make my appointment in 15 minutes. Go ahead and cancel my thing. And he did the 5 crowns with us, but not one time did he ask me what my crown fee was.
Right. Yeah.
All he was focused on the discount. That was it. So in essence, he probably paid the same, if not more, after the discount in my practice than where he was. So again, it's going to work on multiple levels. How it really is going to work for you is kind of like what I've talked about in my book, is if you can go find these active independent living retirees and where they're hanging out, where they're living together in communities especially, and you can go speak to them about this topic and others, man, that's how you really can grow your practice, grow your business.
Oh, yeah.
Yeah. What you just described. Go ahead, Jordan.
I wanted to comment on that because we've got a lot of practices that I speak to that do a similar strategy like you talk about. What are your thoughts on going to like local small businesses and getting them to sign up to on the membership program? Have you had any experience with that or success with that?
Yeah, definitely. And of course, like most things, the best people to ask are the people you have the best relationship with. So when you find an existing patient sitting in your chair who's a small business owner, well, that is the perfect person to have a conversation with, right? And say, hey, you've got less than 50 employees, you're a small business owner. Are you providing dental benefits for them? And most of the time, you're going to find the answer is no, they're not. And you can say, okay, well, I can understand that. And you can offer this to them as something that they can pay at a reduced rate. Maybe if they bring you 50 employees, you may give them a bigger discount. Maybe you make yours $250 instead of $299 per person because of the volume. And it's an inexpensive way for them to provide a dental benefit for their employees. If they don't want it as an expense on the business, they can offer it to their employees as a pre-tax benefit, so they can pay for it and take it out of their checks pre-tax. I've heard recently that they can, check with your accountant in your state, but I think it's a federal law that, if you have under 50 employees, your business can now create an HSA plan for them, and the business, if you will pay for your savings plan. Kind of like this. So the employee would pay for the savings plan, and they would pay for any work they needed during the year. But there would be money taken out of their check every month, and at the end of the year, the business would reimburse them in full from the HSA account for what they spent on the savings plan and the dental work that they did. So now they can get their dental done on a pre-tax basis. So there's a lot more benefit to these small businesses than I think most people realize.
Yeah, I agree.
Perfect people to go promote this to.
Yeah, I agree, especially if you can do HSA, accounts. And I know we just enabled in our software, we enabled patients that they can use oh my gosh, I can't speak, an SH, or what is it?
HSA.
HSA. That's it. Oh my gosh, an HSA card. Health savings account. That's easier to say. They can use those cards, in our software. We just enabled that. So that's very interesting that, businesses can pay with that. Another question I got for you, unless Ben, did you have one? I know
No. You go ahead.
Okay. So, Dr. Phelps, we know that you go out and educate the retirement community about your membership program, but what about, what does your office do to educate patients about your membership program when they're waiting in your office? Do you guys do anything special there?
Yeah. Well, actually, most of the time, the first conversation happens on the telephone, right, with a new patient call. And so the questions my team is trained to ask is, kind of after we've made an appointment, or if they're kind of price shopping, if they're kind of asking us how much is your cleaning, how much is your crown, that kind of thing. If kind of price shopping is, if you will, on the hygiene side, they're trained to ask, well, do you have dental insurance or not? And if the answer is no, well, then we go into a presentation on the dental savings plan right there on the telephone, kind of using some of those contrast principles that I mentioned earlier. And we kind of go through and say, well, did you know that if you had bought dental insurance yourself, it would cost you up to $600 a year, and you'd get 2 cleanings, 2 exams, and your set of x-rays for the year. Well, with our dental savings plan, you get the same, if not better, benefits for only $299. So the same 2 cleanings, 2 exams, and x-rays, plus a 10 or 15% discount off everything that we do. How does that sound?
Yeah.
Oh, wow, that sounds pretty good. Or you can even contrast it to your existing fees. Like if they didn't have a savings plan and they paid in full for everything, and we may say, hey, for our exam, comprehensive exam, cleaning, x-rays, and fluoride, everything we would normally do at your first visit, that would normally run you $375. Well, the good news is we have this dental savings plan now for $299. And not only do you get all that in the first visit, but you get everything you need for your second hygiene visit in the year as well. So you get 2 cleanings, 2 exams, 2 x-rays for that
Awesome.
price.
That's called the forced choice.
So we try. Yes.
Yeah.
We try to start the conversation there, right? And especially, it's been great for converting those price shoppers calling about hygiene stuff. If for some reason we've scheduled them and haven't really had the conversation, once they're in the chair, we always mention them. We have signs posted about it or whatever. We kind of make it a light sale because I don't really want to push it on people. But what I find the best time to talk to people about it is when they need treatment done. And so if they're coming out of hygiene, they're service patients, and there's treatment that needs to be scheduled and a financial arrangement to be discussed, that's the time to present what can happen, right? And hey, well, here's, with these 3 crowns, you're looking at $3,600, right? But with our savings plan, you'd save 10% off of that. So your price would only be this. And in essence, the savings would pay for your cleanings and hygienes for the year, right? That you would need anyway.
Yeah.
So we're using that as leverage to offset what they're going to pay us, and it's motivating more people to say yes to treatment.
Yeah, it's
very cool.
Absolutely a no-brainer. I mean, if you go to any urgent care clinic, they present it the same way. I went to an urgent care clinic without using my insurance card. Had an ear infection, and they did the same thing. My fee that I was going to pay out of pocket, fee for service, was I think closer to $290. But if I enrolled with the membership program, which was $119, my visit for that day would be covered. And in my mind, I'm thinking, who would say no to this? I mean, if you say no, you're just an idiot. Why are you going to throw away an extra couple $100? But a few statistics I want to point out, Dr. Phelps. So I deal with a lot of insurance carriers. I have some of them that like me, most of them don't. The brokers community, all of them like me. And so I gather a lot of this data. And the data that I collected to date, which is consistent with the data that's reported on a national level with insurance carriers and brokerages, is that of all insured patients, 48% of them are active. Of that 48%, meaning 48% come and see the dentist at least once a year, of that 48%, only 7% max out their benefits on a calendar year. So when you really think about how insurance carriers make their money, how do they make their money? They make their money on the 52% that don't come in. So just to throw some numbers out, I mean, off of a 5,000 a patient base of 5,000 lives or people, and let's say that those patients, their insurance costs $35. So that's $2.4 million in premiums that the insurance carrier collects from these individuals on an annual basis. $1,500 annual maximum. That means that the insurance carrier is insuring $7.5 million to insure those 5,000 patients on an annual basis. You and I both know that insurance carriers make a boatload of money, a lot more money, unfortunately, on average, than what the dentists make. But when you break down the numbers, 7.5 million, if every patient were to use their benefits, there's no way the dental insurance industry would ever stand a chance.
They couldn't support it.
That's
yeah.
right. All they're collecting is
No,
2.
like run on the bank.
Exactly. All they're collecting is 2.4 million, and that's where they make their money. Only 48% of people ever use their benefits, and that the adjudication process where you submit a claim and it gets denied. That's the motivation on their end to not pay the claim, is to really reduce the 2.4 million from leaving their bank accounts. When you equate that to a membership program, in my mind, it's got to be the same. If you're charging you're charging, I think the statistic that one of the brokers that I talked to, he said less than 15% of the uninsured ever come in and see a dentist each year, and most of that 15% are emergency cases. So patients that don't have insurance, they don't pay for a benefit, they simply just do not come in, which kind of leads me to the next question is, a lot of doctors are hesitant to start their membership program, and I tell them, like, look, you got to realize and understand how insurance carriers make their money from a premium perspective. That $2.99 that you're charging, in essence, can be equated to a premium. Not everybody's going to use it, but they're going to purchase it knowing that, number one, they save money on their first visit, and whether they use the benefit or not for the remainder of the year, that's fine. They've already captured their savings under Dr. Phelps' plan. But circling back to the fact that if they have some type of plan, they're more likely to use their benefit. So you make money in two ways. Number one, off of the membership fee. 48% of them may use it throughout the year. 52% may not come in, and that's totally fine. You now earn profits like an insurance carrier does. But for the patients that are active, that come in, now you have a lot more treatment because there's simply a lot more utilization of the codes. There's more services being offered. And that's what I tell them, doctors that are on the fence in terms of thinking about whether or not they want to do a membership program. How do you address? I'm sure you have a much more powerful response than I do, being that you're the expert in this field. But how do you get doctors that are on the fence who don't know whether they want to start a membership program or not?
Well, like I said, I kind of paint the picture of what's coming down the road and how it's best to diversify today so that they're not hitting a brick wall tomorrow. Make things smooth while you can, and find a different way to grow, find a better market, a better quality patient. I talk about the benefits, like you said, the recurring income, which is great, as they're, especially once you get past year 1 and 2 and 3 and whatever, year 5 now. So, the recurring income every month is kind of nice from all the renewals. It also gives you leverage to decrease your lost opportunity. And so one of the problems I find what doctors have is with no-shows, right? Or people canceling their appointment at the last minute for the afternoon day. The hygiene schedule falls apart from 10 to 4 or whatever on a Wednesday. Well, now they've actually got some options. So if they've got these hygiene spots suddenly open this afternoon, with an insurance patient, you can't call somebody scheduled 2 weeks out because they have to wait 6 months and a day before the insurance will pay. Right? With a savings plan patient, I can call them 2 or 3 weeks out, and most of them are retired, and I can be like, Bill, what are you doing? Nothing. Sitting around the house. That's right. You want to get your teeth clean? Get your butt up here.
Come on up. That's awesome.
And I mean, we'll usually get the savings plan patient to come in and fill that spot, and now I got 2 or 3 weeks to put a new patient in that spot, right? Whereas normally I wouldn't have had room for him.
Yeah.
So I'm getting to capitalize on that opportunity I would have lost otherwise. So there's just too many things that are slated in our favor of why they should make a move and not get left behind. And be the last one to come out with their savings plan in their area.
Yeah. And then they get at that time it becomes a little bit more competitive because more and more practices are starting to do these programs, and I mean I've seen it across the nation. So yeah, I like that point,
Yeah,
Doctor.
this is who was it who we talked to, Jordan, Jason Campbell, Dr. Campbell. He's talking about the Blue Ocean's opportunity.
Yes,
Blue
exactly.
Ocean strategy. I think, my opinion, this is a Blue Ocean strategy. A lot of people don't really realize there are more uninsured patients out there than there are insured patients. So where's the opportunity?
Well, and what did you say the other day at the meeting that we were at, Ben? That here in Utah, there's a population of 3 million, and then only 1 million have dental insurance.
There's only a third. That. It's even less in our state. Only a third of the residents here are insured on the dental side, which means that the membership opportunity here, in-house membership opportunity, is huge. I mean, people just don't realize how important and how much of an opportunity that's on their hands if they worked on it.
Yeah, and your state out there, whatever state you're in, it may be the same story for you guys out there, as is kind of my thoughts there. Let's see. Let's talk a little bit about the principles of influence. What are they? What are the principles of influence? I know you're kind of an expert on this topic, Dr. Phelps.
Yeah. This is the principles are based off the research of Dr. Robert Cialdini, and what he was doing was looking at all these different sales trainings out there and how do people influence us as the consumer to say yes to their request to buy or purchase or whatever. And what he noticed were 6 key things, 6 patterns that kept popping up in each of their sales techniques and trainings. And so he did his initial research on what these 6 things were and kind of what makes them tick. And so the first principle is the principle of reciprocity. If we give someone a gift of value, they instinctively feel the need to give back at some point and reciprocate. Somebody gives you a gift, you feel the need to at least give back a note at a minimum. Somebody does you a favor, you feel the need to help them out if they need a favor down the road. The liking principle, it was kind of like where people like to do business with those they like. I mean, who doesn't like to do business with their friends, right? And so figuring out ways to build better relationships with people sets the stage for them to say yes to when we ask them for things. The consensus principle or social proof is probably the most powerful marketing tool being used right now to influence people. And basically what consensus is that many times we look to the behavior, what others around us are doing to show us what we should be doing, right? We look to see what others are doing to show us what we should be doing. That's consensus. Authority is that a lot of times we look to credible experts to tell us what we should do. I don't have time to be the expert in this or that, but if you're telling me this is what I need to do, okay, then I guess I need to do that. Mm-hmm. Consistency. Yeah, consistency kind of goes back to what we've said before about the membership mindset, is when people make a real commitment about something, okay, there's a lot of internal and external pressure on them to stay consistent and follow through and do with what they said they were going to do. So when our patients are committing to the idea that they have this membership plan and that they save money because of it, well, now, because of that commitment, they're now more likely to buy when we make a request for them to do so. And then, of course, last but not least is scarcity, which is a lot of people know scarcity. It's probably the most abused thing in marketing against us in an unethical way. Ethical scarcity, when it's true, it's extremely powerful, is that when resources are limited, suddenly we want it more and we'll pay more to get it. Yeah. It's as simple as that, And that's what these 6 principles are. And so I've spent a lot of time trying to figure out, studying the research with Dr. Cialdini, and I was very fortunate to be able to train under him, but also trying to figure out, well, these great concepts, but what do I do with it? How do I use these in my practice to tackle the challenges I see, to decrease those no-shows, to get more people to pay their bill today, to make my marketing more effective, to increase case acceptance across the board, to get more referrals or Google reviews. How do I do that? And so that's what I spend a lot of time trying to figure out and create some systems to do. Just how do I get more savings plans people, right? How do I influence my savings plan population to refer more people to me?
Yeah, I
Those
got a
are
quick
kind of what
thought on that. So usually when I'm talking to, so I've read both the books by Dr. Is it was it Cialdini or
Charlie.
Cialdini? Cialdini, yeah. And
Charlie.
I'm a huge fan of his concepts, of influence. Um, when you're talking to patients about your membership program, one thing that I recommend practices do is maybe offer a gift for when they sign up, after they sign up. Is that something you do in your practice, the law of reciprocity there, or what are some tips, I guess, you do to influence a patient to sign up for your membership program?
Yeah, well, you have to uh, rethink your focus on those words there. So gifts versus rewards, right? So if you're saying
Uh-huh.
you get this if you sign up, well, that's not really a gift, right? That's a reward. So you're
Okay.
not really, if you do this, then you get this. That's a reward. So that doesn't really invoke the reciprocity principle.
Okay.
Ideally, a gift is given on the front end freely, and then you're not expecting
Anything in
anything in
return.
return necessarily. So the idea would be that if they came to your office and you gave them a $5 gift card to thank them for being your patient, and then if it was a place that it was not only unexpected, but a place that they valued or had significance to them, and they thanked you for it, well, that would be the time to turn around and acknowledge that and say, hey, my pleasure. Oh, and by the way, have you heard about our dental savings plan? Let me tell you about it.
Okay.
Right?
Very
So
interesting.
after you gift, then you start talking about what you want to talk about, right? Or asking a request of them, say to buy. But honestly, for my patients, especially this active independent living crowd, I used it a little different way, So ideally, the contrast principle alone is going to be very strong and will influence more people to say yes, just by starting with talking about what dental insurance would cost them and the little amount of stuff they actually get for that amount versus what your savings plan is going to cost them and all the benefits they're going to get. That's a very powerful tool right there. I mean, contrast is one of those things that is, if Cialdini went back and rewrote his book, I think he'd tell you it'd be the seventh principle of influence. It's just that powerful. The only thing that was going on when he was doing his research was that nobody was using it. So
Yeah.
he didn't see it at the time. Now we know, seeing it everywhere. It's always present and always available, which is kind of cool. So what I did was when you go to these active independent living retirement communities, and I'm doing these wine and cheese educational seminars, my goal is to give them that's my reciprocity gift. I'm inviting them to come to a seminar.
Okay.
I'm going to give them a good bit of educational content. So I really want them to feel like they've got some good tips, actionable items they can go home with, right? And they felt like they learned something as a result. The time we spend with them doing this, with our team members, whether we realize it or not, that's a gift. Answering their questions, the wine and cheese that I give them, and I give them some of my, Napa Valley stocks. I give them the good stuff. Well received, and that's the gift I'm freely giving. And I'm not, I mean, technically, they don't have to do anything. They don't have to schedule. They don't have to do anything, to get it. They just have to show up. But what it does is it gets those early adapters in that community feeling kind of indebted to you and want to reciprocate. So they want to come in and try you out. And then if you do what you say you do and you give them a great experience, they go back and tell the rest of the community, no, they're legit. This is a safe place to go. And it reduces their uncertainty for the rest of the community on why they need to come see you too. So
That's
Very
awesome.
interesting.
Well, Dr.
No,
Phelps,
that's really good.
yeah, this has been very enlightening. Excuse me, having you on the program again has been really fun. We do have all your contact information that's posted on the previous show notes, the interview that you did with us a few months ago. But if doctors want to learn more, website? Do you have a website they can go
yeah,
to?
definitely. Yeah, I actually do a whole 2-day training just on the principles of influence and how it applies to dentistry and all the different systems I've come up with to tackle those issues I told you about. The June 2nd and 3rd is my next one here in Charlotte. But you go to the website, which is guide, GUIDE, THEMTOYES. So guidethemtoyes.com. And one of the things you'll learn in the presentation is I'll teach you not only how did I increase my new patients from the savings plan to get 90 new patients over a 3-month period, but how I influence those 90 people to refer 90 more people to the practice.
Awesome.
Yeah.
Very cool.
That's a new
Best
website.
ROI
Yeah.
you'll ever get. from a marketing endeavor. So I've got all my course trainings for the influence stuff, and the dates are listed there. So
Perfect.
I'm
glad I asked that because we have the membershipsavingsplan.com, call tracker ROI, Dr. Phelps, Phelps.com?
Phelps, yeah.
Dr. Phelps helps, yeah.
Phelps helps. Oh, there you go.
Yep.
And then the guy.
Yeah, and of course, guide them to yes.
Guide them to yes. Okay, we'll post all that in the show notes.
Well, and the other one. Yeah, and I got to add another one, because sure. I need more websites.
I've got a lot of websites too, Doctor, so it's not a big deal.
Yeah, goldengoosescheduling.com. So that's it's kind of a cool endeavor. My, the big issue I found with my call tracker clients throughout the nation is that they're not answering their new patient phone calls. Anywhere from 32 to 60% of them.
Wow.
And they're only converting 34% of the calls that they do answer and talk to into appointments. So you can imagine the opportunity just being wasted every month from marketing and whatever. So finally, I had enough of them just ask me. They're like, look, if you just answered my calls and scheduled them for me, you could train your team in the influence stuff and the telephone language stuff, and we'd pay you for it. So that's what Golden Goose Scheduling does. So now we schedule new patient appointments.
And I'm guessing your staff is trained like with the concepts of influence and just like sales to help close those deals for the practices, correct?
That's it. Cool. And so that's why right. My facets were always for the scheduling center, where we are going to answer 100% of the calls that come in from new patient sources. But my team's going to be able to convert as good, if not better, than your team. And so far, we've got over 30 clients using the service. Even the better ones, we're beating every one of them.
Wow. So Golden Goose Scheduling. A good Gosh, we could spend an hour on phone calls.
Yeah, I think we could.
Yeah. But out of respect for your time, we don't want to abuse the privilege of having you on the program. But this has been really great, Dr. Phelps. We'll post all the contact information. Are you okay if we still share your email? Your Gmail email?
Yeah, definitely.
drchrisdmd at gmail.com. Perfect. And we invite all our listeners to reach out to Dr. Phelps and his team. He's been a valuable resource to us and our clients. I really appreciate you being on the program today. It's been a treat. Thank you so much, Dr. Phelps.
Yep, thank you.
Thanks, guys.
That's it, folks. Thanks again for tuning in. Hey, if you have any friends who want to learn more about the stuff that we talk about, please let them know that we exist. Referring your friends to saynotoppos.com is the best way you can show your support for us. However, if you don't like the podcast, we'll give you a full refund. Also, let us know if you want to hear anything new or something that we haven't covered just yet. Try to keep the topics to PPOs as that's our area of expertise and things that we know the best. Just email me at help@veritasdentalresources.com. Veritas is spelled V as in Victor, ERITAS, veritasdentalresources.com. I will post that on the show notes, so if you're driving, please don't take your hands or eyes off the road. Thanks again for all your support, and we wish you the best of success. Signing off from Salt Lake City, Utah, this is Ben Tuine on behalf of my good colleague, Jordan Comstock.